My name is Shamini Govender, and I'm a pediatrician. I love being a pediatrician. Kids are so much fun, and they bring out my playful side. It's also very challenging to figure out what's going on in a newborn that can't talk or a toddler that resists the exam. And I also love that the wisdom in pediatrics is that we can plant a seed in a child that will bloom for years to come to prevent disease. One interest that I have is in feeding and nutrition. So whether that's breastfeeding in the newborn period or introducing solid foods or navigating the pitfalls of a picky eater in toddlerhood and establishing a healthy relationship to food in an older teenager. I'm also appreciating more and more how the mind and body are connected. And so while I talk about physical health with my patients, I also want to build their emotional resilience as well. Wellness visits are very important because we need to establish a baseline of what your child is like when they're well, so we know how off they are when they're sick. It also allows us to establish trust so that they're more willing to come to us when they're sick and allow us to examine them. The most important part of the doctor-patient relationship is open communication, and that requires trust and honesty and respect. Having a pediatrician is so important because the advice that I give a 2-day-old is different than a 2-week-old and a 2-month-old and a 2-year-old. So you need someone who's an expert in all of those ages for their developmental milestones. The most satisfying part of my job is seeing a child smile and hearing their gleeful giggle and full-blown laughter. That brings me so much joy.